All right, today we're going to talk about something that can be a little freaky, but is actually super common: ganglion cysts. We're going to cover everything from what they are to what you can do about them.
So, have you ever found one of these? A mysterious little lump on your hand or wrist? It happens all the time. You're just living your life and boom, there's this weird, firm bump that seems to have appeared out of nowhere. And yeah, it can definitely make you a little nervous, but a lot of the time it's just a ganglion cyst.
Okay, so what is a ganglion cyst, really? Let's break down the basics.
Okay, first things first, and this is the big one. They are not cancerous. They're totally benign. The best way to picture it is like a little balloon of joint fluid. It's basically a small sac that's kind of pushed its way out from a joint or a tendon and filled up with that thick gel-like stuff that keeps everything moving smoothly.
So who gets these things? Well, they're actually the #1 most common type of lump you'll find on your hand or wrist. They tend to show up more in women, usually between the ages of 20 and 40. And it makes sense, right? They're also common in people who use their wrists a lot. Think athletes or anyone doing manual labor. And get this, a whopping 70% of them show up right on the back of the wrist. That's a huge majority.
All right, so you've got this lump. Now what? The next step, obviously, is getting a real diagnosis. So let's talk about what you'll feel, what a doctor will see, and what you should do.
It's kind of interesting, right? There's what you feel, and then there's what your doctor finds. For you, it's that visible lump, maybe some pain when you move, or a dull ache. You might even get some tingling if it's pushing on a nerve. But your doctor? They're going to find a smooth, round mass. And they have this cool little trick called transillumination. Basically, they'll shine a bright light on it, and because it's just filled with fluid, the whole thing just glows. It's a dead giveaway.
Honestly, most of the time, all it takes is a quick physical exam. Not usually enough. If the doctor's not 100% sure, they might do an ultrasound, just to confirm it's fluid-filled and not something solid. An X-ray could be used to rule out other stuff like arthritis, but an MRI? Yeah, that's pretty rare. They usually don't need to go that far.
Okay, this is important. Even though these are usually harmless, there are some red flags you need to watch out for. You absolutely need to get it checked out if it starts growing really fast, if you get constant numbness or tingling, or if it gets super painful and red. And for sure, if you can't move your wrist or finger like you normally would, that's a definite sign to call your doctor.
So you've got the diagnosis. The big question now is, what are you going to do about it? Let's walk through your options for relief.
The good news is, the treatment path usually starts simple and only gets more involved if it needs to. The first step? Believe it or not, it's often just watching and waiting. A lot of these cysts just go away on their own. If it's bothering you, though, step 2 might be what's called aspiration. That's where they use a needle to drain the fluid out. And if it's really stubborn or painful, the final option is surgery to have it removed.
So let's put the two many medical options head-to-head: aspiration versus surgery. Aspiration is super simple, right? It's just a needle, they drain the fluid, and you're done. The problem? The success rate is just okay, because it's pretty common for it to come right back. Surgery, on the other hand, is a much bigger deal. They go in and remove the cyst and its stalk or root. That's why the success rate is way higher, over 90%. But, it's still surgery, so you've got the usual risks like soreness, swelling, and a scar.
So why does it come back so often after aspiration? It all comes down to the stalk. That's the little root that connects the cyst to the joint. When you just drain it, you're leaving that root behind. It's like pulling the top off a weed. The root's still there, so it's probably going to grow back. Surgery gets rid of the whole shebang, root and all, which is why it's so much more permanent.
Okay, let's say you go the surgery route. What should you expect when it comes to recovery?
The recovery timeline is actually pretty straightforward. You'll likely be back to any desk work within about 3 to 7 days. After a week or two, you can start doing lighter things. At about the 1-month mark, you'll start some strengthening exercises. And for getting back to heavy-duty activities, you're probably looking at around 4 to 6 weeks.
Now, just like with any procedure, you gotta keep an eye out for warning signs afterwards. If you see the area getting more red or warm, any kind of pus or weird drainage, or if you get a fever or chills, call your doctor. Same goes for any really bad pain that your meds aren't touching, or any new weakness or numbness. Don't wait on those.
So, after all that, what's the big takeaway? It's this. Ganglion cysts are super common, and they are completely benign. They're harmless. The choice to do something about it? That really just boils down to one thing. Is it bothering you? If it's not causing pain or limiting what you can do, you might not need to do anything at all.
So now you've got the facts. The real question is, what's the right move for your peace of mind?
Whether you choose to just keep an eye on it or look into treatment, now you know what your options are. The goal here was to give you the info you need to have a smart conversation with your doctor, because that's always the best way to figure out the right path for you. Thanks for tuning in.